abájọrò kì í pẹ́ kú. Ohun àṣepọ̀ nílẹ̀yẹ. Ẹ̀yìn ọ̀la wa ti dára ọ́. Àwa Èkìtì àti parapọ̀. Ká parapọ̀ ká tún bá mú pọ̀. Àwa Èkìtì àti gómìnira ọ̀kan làwa ń ṣe. Èkìtì Èkìtì tí gbòmìnira. Èkìtì Èkìtì tí gbòmìnira. Àwa Èkìtì iwájú la ó máa lọ lágbára Ọlọ́run. Àwa Èkìtì ọ̀kan ṣoṣo máa ní wá o láéláé.
Ekiti State. It is my pleasure to address you again on the state of things in respect of our collective fight against COVID-19 pandemic. You would recall that our state has been proactive in this fight because of our appreciation of the enormous catastrophe that a wide breakout of the infection could cause in our state. Right from the outset of this pandemic in Nigeria, Ekiti State has been at the forefront of the fight against the virus. We set up the State Task Force on COVID-19 on March 2nd, 2020, as the first state to do so in the Federation. We were also the first to announce comprehensive restrictions, amongst other initiatives which began on March 30th, 2020, and ended on April 13, 2020. Thereafter, we extended the restriction by another 2 weeks, which ended on April 30th, 2020. About 4 weeks ago, in compliance with the national strategy to contain the disease and to ensure that nothing was left to chance, we further adopted a total lockdown with a window of movement allowed in 3 days of the week. We have adopted these extreme measures to ensure Ekiti people were not in danger, as there were no better alternatives to mitigate the potential havoc that a community spread could bring about. In response to the challenges faced by the vulnerable segment of our society, which depends on daily income to make a living, our government has distributed palliatives to thousands of households to cushion the economic effect that the lockdown must have cost them. It is something of pride to note that our template of palliative distribution has been widely adjudged the best and commended for its inclusive and transparent delivery to households. All of this we have done to ease the pains that Ekiti people have borne while the fight against this virus lasts. As a government, we are well acquainted with your pain, sacrifices, and losses. We cannot quantify the cost of this pandemic on you as individuals and government as a whole. The cost on government, business owners, families, individuals, religious organizations, schools, and other aspects of life has been huge. But these costs are the cheapest sacrifices available for us as a people, as the alternative could have been devastating. I therefore want to appreciate our religious leaders, private school owners, market men and women, artisans, and students for your sacrifices, cooperation, and support so far. As I had indicated in my last broadcast, that government will continue to monitor progress and act promptly to exigencies as they occur. I am glad to bring you up to date about the journey so far and to keep you abreast of the next turn in this enduring journey. Since we declared this second wave of lockdown a month ago, partly in consonance with national strategy to ban interstate movement, we have made some appreciable progress, which now makes a review of the existing regulations necessary. As of today, Ekiti State has recorded 20 cases in all. 16 of these people have been successfully treated and discharged. We have only 2 active cases left in our treatment and isolation center. Unfortunately, we have lost 2 of the cases. So far, we have done about 300 contact tracing and tested well over 200 people. As part of efforts to ramp up our testing for the virus, I will be commissioning the mobile molecular testing laboratory procured by the COVID-19 Resource Mobilization Committee headed by Chief Julius Adeluyi tomorrow, June 1st, 2020. Test samples will be randomly and voluntarily collected from local government to local government and community to community. We must give them maximum support as our experts have devised a modality for this exercise across the state. Testing is not injurious to anyone, and it does no harm to those being tested. It does not also suggest that those tested already have the virus or that they are suspected of having the virus. The random test is part of the global and national strategy to be sure that we do not have community infection that have not been discovered. You will recall that I had had to take the test myself at the outbreak of the virus in Nigeria. Thankfully, my test came out negative, and I have been at peace with myself ever since. It is therefore nothing to be apprehensive about. Once the report of the random testing shows that we're safe generally, it would further give fillip to our confidence to fully open up our state and return to our normal way of life. I therefore urge you to willingly submit yourselves for testing when the officials get to your neighborhood. This also provides an opportunity for those who might have had symptoms associated with COVID-19 to freely come out for testing at no cost to them. Ekiti State, based on the advice of the professionals and the general risk appraisal of the state and the nation at large, government has, in the meantime, decided to review the current measures and to further ease the restrictions as follows. 1. Commencing from tomorrow, June 1st, 2020, Ekiti people will now be able to go about their daily activities from Monday to Friday, 6 a.m. to 8 p.m. in the evening. For the avoidance of doubt, the dusk to dawn curfew will daily resume at 8 p.m. till 5:59 a.m. of the following morning. 2. Ekiti State public officers on grade level 8 and above are to resume duty from June 1st, 2020, while those on level 7 and below are to remain at home for now. 3. Existing restrictions on human and vehicular movement will continue to be observed in accordance with existing regulations contained in the Ekiti State Coronavirus Disease Prevention of Infection Regulations 2020. 4. For now, Ekiti boundaries will remain on complete lockdown daily, pending further review at the national level. 5. Government is considering reopening the major markets to permanent shop owners after the outcome of the engagement process that is ongoing on the relocation of roadside traders to the available alternative markets being prepared for them. The reopening will be subject to compliance with specific conditions and protocols that are being determined. Similarly, government has considered the impact of the continued stay at home of our children. Therefore, effort is ongoing to reopen the schools as soon as the committee set up to appraise the protocols, resources, conditions, and modalities for reopening has concluded its work. As part of steps leading to the reopening of the schools, I have directed the Ministry of Education, Science and Technology to commence a stakeholders engagement, including teachers, parents, vendors, school administrators, and school owners, immediately for a common position on the best way to manage the situation. This is without prejudice to what may be decided subsequently at the national level in respect of school reopening. A similar committee will be engaging with the religious organizations to fashion out a workable protocol that will enable the religious houses to reopen very soon without jeopardizing the lives and health of worshippers. I'd like to reiterate that the ban on social gathering on account of religious, educational, political, or any reasons whatsoever remains in force until the ongoing consultations are concluded. Ekiti State, as we enter another phase in the fight against the invisible but lethal enemy, there is even now a greater demand on all of us to take personal responsibility. While government will not shirk its responsibility of ensuring the lives of the people are protected, we cannot afford to be complacent or fatalistic about the pandemic. We have been fortunate so far not to have experienced mass infections and fatalities as seen in other parts of the world where medical know-how, technology, and resources are much better, but we should not stretch our luck beyond the elastic limit by being complacent, especially now that more people will be tested regularly in Ekiti State. We must never trivialize the danger that COVID-19 continues to pose to us. We must ensure we do not have a reversal of fortune. We cannot afford a community infection that could easily overwhelm our medical capacity and return us to another round of stay at home with even more stringent measures. I therefore want to reiterate that the protocols about personal hygiene, hand washing, use of alcohol-based hand sanitizers, physical and social distancing, use of face masks in public must continue to be observed whilst our state boundaries remain shut down. Our public transport operators must continue to comply with the protocols guiding their operations. Government will be very hard on offenders because to whom much is given, much is expected. As I conclude this broadcast, I would like to express my immense appreciation to our frontline medical personnel, our task force team, security agents, and the general public. We are also indebted to the esteemed members of the COVID-19 Response Resource Mobilization Committee under the able leadership of Areafe Babalola and the chairmanship of Prince Julius Adelusi for their tremendous contribution to the fight. We owe them immeasurable appreciation for the procurement of the mobile molecular laboratory and other critical interventions that the committee has provided. We are also grateful to the Coalition Against COVID-19, CACOVID, under the chairmanship of Alhaji Dangote, and the Victim Support Fund under the leadership of Lieutenant General Retired Theophilus Danjuma for their contribution and donation to the state. We also appreciate the great work being done by the Presidential Task Force on COVID-19 and the hard-working team at the National Center for Disease Control under the leadership of Dr. Chikwe Ihekwezu. We're deeply thankful to those who have donated money and material resources, as well as those who have volunteered their property for use as isolation centers. We appreciate those who have volunteered information about those sneaking into the state. This kind of information has saved the state the possibility of community transmission, as 2 of such cases later turned out to be infected persons. We need to remain more vigilant than ever and to continue to be watchful. Thank you all. May we all see the end of this COVID-19 pandemic, and it is my prayer that none of us shall be missing when it is time for the victory song. Thank you. Alale Ekiti, Agbeketera.
Ohun abájọ rò kí tí gbòmìnira. Àwa Èkìtì iwájú la ó máa lọ lágbára Ọlọ́run. Àwa Èkìtì ọ̀kan ṣoṣo mà ni wá.